So I'm going to speak specifically in the realm of nursing that I'm like directly involved in, which is like the long-term care and skilled world. So I think I'm going to talk staffing first. And I know staffing is an issue in all different settings countrywide. However, I think long-term care specifically struggled pre-pandemic, and we continue to struggle post-pandemic. So I think specifically like certified nursing assistants during the pandemic were able to go out and to basically name their schedule, name their price. And I think the field actually became oversaturated for a minute where everyone wanted to be a CNA, and it's like the quickest path to be able to get into the field. However, I think that now rates have kind of like stabilized, and I think that they're better than they were. I still don't think they are what they should be. So for example, like at my building, and I'm speaking just in CNA terms right now, we have very few staff CNAs on our schedule at all. We are like primarily filling through agency, travelers, and like the staffing apps. So we, with that, it's a double-edged sword for sure. The one side of it is that there is no continuity of care. Our residents don't know who they're getting. Sure, we have some people that are our regulars through agency and pick up with us a lot, in our contract staff same way. But also it's costing, the facility a lot more money than it would to have full-time staff. However, it's just, there's just really like a no-win situation right now. We are, I think that people realize that we had to do something because we're spending so much money on agency staff. So they did increase some incentives for nursing and for nursing in general, CNAs, LPNs, RNs, to pick up for like outside of their extra shifts. So that has been helping. But I think staffing overall, is a huge challenge that we all faced pre-pandemic and continue to face post-pandemic.
Yeah. Wow. Okay. And then with that question too, I guess this would be kind of a shout out time for like what you're talking about. You're kind of getting into the employer basis, and do what it is you can and say what it is you're comfortable saying. But I wanted to say, like, are there any issues that maybe like were addressed that or that you didn't feel were really addressed as fully, like any past or maybe present incidents, that you'd like to mention today, or sorry, like they could have been handled better, sorry, or maybe that they were handled very well, and then like, what did you say to your employer? Like, what did they say? What kind of actions were taken?
Sure. So I think like one of the things that like we honestly have struggled with in particular, like just at my building, is we have a very difficult time keeping a staffer. So a scheduler or staffer, like interchangeably. So I think that is a low paying position. I think that it's typically, it is one of the hardest jobs in the building. I work at a 180 bed facility. There is a ton of staff. Like I just spoke on, like we use multiple agencies, multiple contracts, and like then we have our staff as well. So with a high scheduler turnover, as a nurse, like for me, my schedule is like the most important. I work every Saturday and Sunday, and other than that, like I know I'm going to have 5 days off a week, and I can do whatever I want those 5 days. I can schedule whatever I want in advance. For like this month, our master schedule only goes out till June 3rd, and no one has a schedule like following that. So I think that is something like a problem within my workplace right now, just as far as with the scheduler turnover and like not having a scheduler or staffer right now, is that I think schedules are very, very important to the majority of the world. Like as far as like it's summer, people have kids, people want to make plans, people want to know if they're getting their requested time off, and so they can proceed forward. And that unfortunately has not been a consistent in my building for a very long time. It's something I think we are definitely working to fix, but you can't make people stay. I think I don't know if some like a higher pay would help benefit that, like more training, or what. I think overall the position just comes with like a high burnout and high turnover rate. And I honestly am not, 100% sure how to fix that. I think you have to kind of fix I think you have to fix the staffing at ground up first. So I think by offering those incentives and having more of our staff pick up less agency, it makes doing the schedule a little easier. So hopefully that will continue and help our next scheduler have success and more overall staff satisfaction.